Welcome. It's August 13, 2024. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. We're going to be performing the Deuk laser disc repair cervical 2-disc C5-C6 C6-C7 on this very nice patient who travels here from Kansas with her husband. And she has 2 herniated discs that are pushing on her nerves and spinal cord. She was recommended for surgery elsewhere. They wanted to do a fusion, but she didn't want metal in her neck, so here we are. We're going to be doing the laser surgery. No metal, no fusion. Welcome to our live stream. Feel free to ask questions. Now, Deuk Spine has been live streaming spine surgery now for 10 years. We were the first in the world to publicly stream the entire surgery, and it's been over 10 years. Shot? All right, I'm going to get focused for a moment. 2, 3, 4, 5, 6, 7. All right, 2, 3, 4, 5, 6, 7. So I'm just over, it's kind of the top part of 6. I'm going to come a little bit lower. Everything good? Berndes, shot? AP? Let's see where we are. Quick AP. Shot? All right, lateral. Get that out of my way. All right, I'm going to slide south. Shot. Shot. That's 2, 3, 4, 5, 6, 7. You agree? Yes. Shot. A little bit too high. Shot. AP. Quick AP. Quick. I can't tell. It looks centered, right? Yes, sir. All right, shot. We'll get it in, and we will see. Shot. Let's just see where that is. Coker, AP. We are placing the needle. That's the first step in this surgery. It's the most difficult part of the surgery, in my opinion. All right, that looks really good. We're slightly off to the left, but I think we're okay because, let's see. You can see the spinous process is coming off to the left. Let's see if we can get in. Shot. We're totally relaxed?
Yes, we are.
All right.
Check, no twitches.
Shot. Let's see if I can plane this in. Shot. Shot. It's just sitting kind of right on the end plate of 7. There we go. Shot. Now we're definitely in and we're good. It's very nice. Take that. If you have questions during our live stream, feel free to ask us. Otherwise, I'm going to keep talking and working at the same time. I'm Dr. Deuk Majin. I'm the neurosurgeon doing the surgery. I'm checking to make sure we are at the right disc. We're doing 2 discs today, 5, 6, 6, 7. We start with this lower one. So that's 2, 3, 4, 5, 6, 7. Everyone agree we're at the right disc, 6, 7? Now we're going to do a discogram. Shot. You're going to see a tear in the back of the disc and a herniation. There's the herniation. Shot. There's the tear. Perfect. So the white arrow is showing you the tear and the herniation, and you can see dye in the epidural space. Next, we're going to place our guide wire. This will guide the dilator. Shot. The dilator is the next instrument I'm going to bring down to the disc. And then over the shot, over the dilator, I'm going to bring down the tube that we're going to do the whole surgery through. The nice thing about this surgery, there's no metal, there's no fusion, there's no hospital, there's no artificial disc, and there's no downtime. People that have this surgery can go back to work the next day if they want to. They'll be a little sore, but you can go back to work. We're just injecting a little numbing medicine because I'm going to make a 4 millimeter incision, 4 millimeters. Bring the ruler. You can see this is a bloodless surgery. We lose literally a few drops of blood and that's it. All right, here's the measuring tape measure, just for reference. I'm going to put it right here. All right. So, I'm going to make my incision. Give me a little blot. Blot. Thank you. That's Luis, by the way, helping me. This whole surgery is done with this 4mm cut. You guys see that?
Yes, we do.
Now, why are we doing this surgery? Well, a couple of reasons. She has herniated discs, but more importantly, these herniated discs are causing symptoms, Shot. And the symptoms she's having, and the symptoms anyone can have from a herniated disc, is neck pain, headaches, pain radiating from the neck into the shoulder. That's from irritation of the nerve root. And then you can have arm symptoms like weakness, numbness, tingling in your arm, all from the nerve being irritated. That nerve is the nerve that starts off your spinal cord and it goes out the hole in the back of the disc. And when you get a herniation, that herniation always affects the nerve root if it's out in the foramen. Any questions?
Yes, we have a question coming from Lanu on YouTube.
All right, Lanu, welcome. Welcome to the live stream. Let's get a shot. Let's get an AP. Let's make sure we're in the middle. See, I'm about to enter the front of the disc, and I'm going to push my dilator through the front. All right, let's. That's the AP. Again, the spine is a little scoliotic, so it looks like we're a little bit off, but I think we're fine in the front of the disc. At this point, I'm going to take out. Let's go lateral. Take out my guide wire, and I'm going to try to reposition my tip of my dilator just slightly in the front of the disc. Shot. And just stay with me for a moment. Shot. All right, I think I moved. Let's get another AP. I moved a little bit to her right. And again, she has scoliosis, so I have to kind of evaluate the x-ray. That's perfect. That's perfect. So we're going to go in here. This way we're not going through the longus colli muscle. All right, perfect. Lanu, we'll take your question. Shot. I'm going to deliver the tip of this dilator to the back of the disc where the tear is and the herniation is. And we're going to remove the herniation and clean the tear with a laser. And while I'm doing that, I'm going to take Lanu's question.
Lanu asked, did this patient ever say how she got the herniated disc?
No, the patient did not tell us how she got the herniated disc, but those herniated discs are probably 20 years old, and I would say at least 20 years old, could be longer. All right, the whole surgery is going to be done in this little tube right here. And just so you understand, this is a 4mm tube. You guys see that?
Yes, we do.
It's like a little coffee straw, but it's not. It's a very expensive coffee straw. Anyway, that said, I'm going to deliver the tube down to the disc, and we're going to literally go past the disc to the back where the herniation and tear are. Okay? We don't really want to mess with the disc. The disc itself is fine. There's nothing wrong with her disc. Even if it's collapsed, there's still nothing wrong with it. It's not causing a disease or a problem, right? What do we treat disease? What is disease? Disease is basically when you have an abnormality of either structure or function in the body, and it could be a physiological disease, it could be a structural disease. Physiological things are small. They involve like chemical reactions, biochemical reactions, enzymes, things like that. In her case, her problem is inflammation happening at the back of the disc. And Henry, let's show the audience that, you know, when it comes to neck pain, there's actually about 30 different causes of neck pain that cause chronic neck pain that lasts more than 6 weeks. Let's show our audience that video.
Copy that.
I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizatum is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You can see from this video that there are 30 different causes of neck pain. If you fix one, you still have 29 potential other causes. So a lot of people come to us with more than one cause of neck pain. They have neck pain, they don't know where it's coming from. By the way, look at this. This is so important. See the pink stuff right there? That's inflammatory tissue. The blue is the herniated disc. The pink is inflammation. Henry,
Yes, sir.
let's show our audience why, of the 30 causes of neck pain, the herniated disc is number one. It's 85% of chronic neck pain. Why does a herniated disc cause chronic neck pain? Let's show the audience why.
Copy that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. You can see from this video that what causes neck pain, the most common cause of neck pain, by the way, is a herniated disc. And it's not just the disc itself, it's actually a tear in the back of the disc that causes all the pain. And that tear is called the annular tear. That's where we are right now. We're cleaning that annular tear. And the laser surgery we're doing, the Deuk laser disc repair, is literally the best surgery in the world to fix that problem. There's nothing better. Other surgeons will offer fusion, metal. Metal is not good for you. If metal was supposed to be in your body, God would have put it there. But metal is not supposed to be in your body. But it's the best that we had for many years. For about 100 years, we had metal, and that was it. But now, we have laser. And Duke Spine Institute and myself, I pioneered this technology. And we were just talking a few minutes ago about how we are sort of like the Star Wars characters of Yoda, Obi-Wan, and Luke Skywalker. So we were talking about Yoda a minute ago, and Yoda is my old teacher, Dr. Anthony Young out of Phoenix. He's now retired, but he practiced until he was like 82. His son Chris has taken over his business, but Chris, oh, look at that herniation. That is a piece of herniation that just popped out from deep, right? That deep is in the epidural space where the spinal cord is. So that's a big piece of herniation there. Probably about 3 or 4 millimeters, which to some people is not really big, but for a herniation fragment, it is big. I'm going to see if I can get it. Nope. Still no. I'm going to have to go back in and zap it a little bit. So it's just not coming out on its own. All right. Henry, why don't we show the audience how the Deuk laser disc repair works?
Copy that.
All right. You can see from our video that we're using the laser to remove pieces of herniation at the back of the disc and to debride the tear at the back of the disc. That's the Deuk laser disc repair procedure. I pioneered it 18 years ago. We published it multiple times in the medical literature. It uses only FDA approved equipment, supplies, and we've been performing it for 18 years, 18 and a half years now. Almost 20 years for the Deuk laser disc repair. Now, Deuk Spine Institute has been around for 20 years, but the procedure we're doing was pioneered and developed by myself and my son Arius, and we both published the results multiple times at medical meetings, neurosurgical meetings around the world. I've even presented it in Hong Kong and all throughout the United States at the American Association of Neurological Surgeons, the Congress of Neurological Surgeons, and NAS, and the Southern Neurosurgical Society. So the procedure has been out there for a few years, quite a few years, and unfortunately it's one of those types of procedures that's very difficult to do technically. Surgeons have to be trained to do it, and the problem is surgeons right now, they're being trained to do fusions, the older technology, fusions and artificial discs. And the truth is, this surgery doesn't pay the surgeon very much. It pays the surgeon very little compared to a fusion. Fusion pays very well. As a matter of fact, surgeons will make 10 times more money doing a fusion than they will this laser surgery. So if you're a patient and you talk to your surgeon, chances are they're not going to recommend this surgery for you for various reasons. One of them being they don't know how to do it, but the other one being they don't want to do it because they're making a lot less money doing this. And as you know, reimbursements have been cut to spine surgeons and doctors by payers, insurance companies. Insurance companies are keeping more and more money for themselves and giving less and less to providers, which is why the providers are struggling to stay in business, and a lot of them just quit and they go work for the hospital. Everything okay?
Yes, everything's good.
All right, our patient is asleep, and we are at the back of her C5-C6 disc. You can see the herniation there. There's a blue herniation right there. And these pieces of herniation are fresh. This one here is probably about 6 months old. We've seen some older pieces as well. So there's different age herniations. As I've said in past videos, the herniated disc we talk about on the MRI is not one herniation, it's not one event, it's many events. And it's many events over many years. So you can have a tear in your disc wall, which is the first step, as you saw in the video. The annular tear must have an annular tear. Once you have the annular tear, you can get a herniation. And the herniation starts with one piece and then a second piece and then a third. And that's over years, you're spitting out more and more pieces of herniation. And the reason the herniations are coming out is because there's a tear in the back of your disc that just cannot heal. Because once you get your first herniation, it blocks the annular tear from healing. So you're stuck with an open annulus. And there's a piece of herniation. So I'm going to go grab that one. I'm going to try to grab it and bring it out. Because it's not floating out. It's too big. All right, we have a question, right, Henry?
Yes, we do. This question coming from Lanu, once more on YouTube,
Excellent.
asking, can herniated discs cause migrant headaches?
Yes, herniated disc can definitely cause headaches. As a matter of fact, Lanu, if you look at my original publication in PubMed, 2/3 of the patients, 66%, had headaches from their herniated disc, and we were able to eliminate headaches, 92% of the headache in those patients, 92%. So we call that a discogenic headache. It's not really a true migraine. It's called a discogenic headache, cervicogenic headache or discogenic headache coming from the disc or the neck, cervicogenic. And it's definitely fixable with this laser surgery. Okay, for those of you who haven't seen this before, that's a piece of herniation right there. That's what they look like. They're small. They are not big. Everyone thinks a herniated disc is big because that's the way they're depicted improperly, because most surgeons cannot see a herniated disc. They only see a bunch of tissue at the end of their microscope or loops. They have no idea that it's multiple pieces. They have no way of knowing that because they've never seen it endoscopically like we see it all the time. Okay, it's the fact that we actually see it endoscopically that we know it's not one piece. We know it's many pieces. Any questions?
At this moment, no current questions.
All right. Now this particular patient, she doesn't just have a herniated disc, two herniated discs causing her neck pain. She has also facet joint pain. And what is facet joint pain? Well, facet joints are little joints in the back of the neck, and there's a pair of facet joints for every disc. So if you have a C5-6 disc, you also have a right C5-6 facet joint and a left C5-6 facet joint. If you look at a spine model, you'll see what I'm talking about. Facet joints are little joints. They're called diarthrodial joints because they're a true joint. They have a synovial surface, synovial membrane, cartilaginous surface of the joint. They have synovial fluid, and they move like any other diarthrodial joint, like a knee, a hip, a shoulder, where you have two bones that come together. This is all scar tissue from chronic inflammation. I'm just looking to see if there's any more herniated disc in the scar tissue because I don't want to leave anything behind. And we can see pretty darn good. And I want to thank ConMed Limbotech, who produces our cameras that we use. I think they're the very best in the business. You got to tell me a little bit more advanced, okay? Anyway, these are bone spurs right here. You can see the laser just chops them up. We don't need to remove every bone spur. People think bone spurs have to be removed. They don't. Most bone spurs cause zero symptoms. Therefore, removing them just puts the patient at risk for no benefit. And I don't believe, and other doctors shouldn't believe, in doing something that creates risk for the patient without a benefit. Okay? So everything we do should have a benefit to the patient, obviously more than a benefit to the surgeon. And Unfortunately, a lot of people are doing things, surgeons are doing things, pain management doctors are doing things that benefit them more than they benefit the patient. And that's not good. I think that's a piece of herniation there. I'm going to go check it out right here. Yes, it is. It's totally scarred up. That's all scar tissue. And it's getting calcified. You guys see that? Amazing.
Yes, we do.
But this is what's pushing on her spinal cord right here. Now, the beauty of the laser is there is no tool in the world that provides as much precision as the laser. She's moving.
We have another question
Sure.
coming from Lanu once more on YouTube.
All right, Lanu, I'll take your question.
He asked a staff question. Is Henry part of the medical staff or the office staff? Just curious.
Henry is part of the office staff.
Yes.
Yeah, Henry is not a doctor.
I am not, no.
Only on the weekends, as Dr. Berndes says. But Henry, no. Henry is our video editor, videographer, creative thinker,
Yes.
philosopher. Not anymore. I mean, I haven't felt it.
Pretty much when any video that comes out of this building, I make sure of it beforehand.
Yeah.
That's me. Lanu.
Yeah, but you're also involved in the website, the
Yeah,
development of the new website. So Henry does a lot, wears a lot of hats like most of our doctors. And he's just a think tank, a fountainhead of ideas.
Thank you.
All right. He's also one of our Israeli employees. So he's near and dear to me since I'm Armenian. And Armenians and Israelis like each other a lot. We both are in Jerusalem.
Yes.
And share our corners of Jerusalem, the Armenian church being in Jerusalem.
There's a
Of course.
humongous Armenian community in
Yeah,
Israel.
yeah.
Humongous.
But we enjoy each other's company tremendously and have a mutual respect for each other's culture.
Of course.
Okay, this is the back of the herniation, and I've gotten rid of the herniation, but there's just a little bit sitting here on top of the spinal cord. I just want to be very careful. We don't want to do any damage to the spinal cord. That's a no-no. It's not acceptable. It's acceptable to other surgeons, not acceptable to me. All right, these are the last pieces of herniation on this disc. We're going to move on to the next disc. But before we do, I wanted to say this patient does have facet joint pain. I diagnosed it when she got here. I told her about it. Facet joints, as I was telling you earlier, are located in the back of the spine, not the front. And we have a treatment for them that now gives permanent relief called the Deuk plasma rhizotomy. So she's going to probably end up coming back to get that done in the future. She's not going to get it done today. We offered it to her, but she wants to hold off. She's got other obligations, and she said if it still bothers her, she'll come back and get it done. But that said, Henry, for the benefit of the patient, her husband, and her family, let's show them how do facet joints cause pain.
Yes, sir.
All right, so you can see from the animation that we just showed you that the facet joint causes pain through inflammation, same as the disc. That's how disc herniations cause pain. And that inflammation is within a different structure than the disc. It's called the facet joint. I think this is the last, there's a piece of herniation right there. You guys see that?
Yes, we do.
Now, this one was just kind of hiding off to the side. It looks like a little octopus, but I'm gonna have to cut it in pieces to get it out. It keeps hiding. It acts like an octopus. It's just running away and hiding. All right, here we go. Let's see if we can't get it out. I'm gonna try to grab it. This is really the only thing keeping us on this disc. We're just about done. Yeah. Yep, we got it. All right. But this is, her surgery is going very well, right, Dr. B? Yes. There's another herniation. And every time I think we're done, we keep getting another piece of herniation that just pops up. And these pieces of herniation, this is an old one. You see how white it is and calcified it is? It's pretty dense, so it's not wanting to come out. It's just wanting to sink down. That means it has a lot of calcium on it. Calcium is a sign of an old herniation. All right, how many pieces of herniation have we taken out? Too many. Henry, let's show the audience and the patient the Deuk plasma rhizotomy.
Copy that.
This herniation back here, and make sure we got as much out as we can.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video that the Deuk plasma rhizotomy is able to go in and destroy the pain nerves to the facet joints, allowing us to give our patients, usually they get cured pain 100%, and it lasts a lifetime. So the goal of rhizotomy is to destroy a pain nerve that innervates the facet, but the problem is nobody's been able to achieve that yet. They use what's called radiofrequency ablation, which does not do the job properly, and that's why people with RFA keep coming back, having to have the procedure repeated. But with the Deuk plasma rhizotomy, which is, by the way, a patented procedure, we are able to permanently eliminate the facet pain. Okay, I'm just about done. I'm just looking out the foramen here, and there's still some herniation, and I wanted to just get it before I finish. Little bits left. But one more thing I want you guys to know. We cannot remove 100% of the herniation. It's impossible. And I say this every surgery almost, but I want to remind people, when you take a herniation out, remember you're taking about 30 pieces out. And there's no way to get 100% of them because they're hidden behind bones, they're hidden in the back of the disc. There's just not possible to get them all. So what we want to do is get most of it. And most of it's 50%. If you can get most of the herniation, then you can get rid of the patient's symptoms. So that's what our goal is. Get rid of the symptoms by getting rid of most of the herniation. Here's another piece. I've lost count. I can't even tell you how many pieces of herniation we've taken out, but it's at least 20, maybe 30. There's a little bit left of the tear. Thank you. All right, I know we have some questions, so while we're finishing this up, let's take the questions.
This next question coming from Danny on YouTube,
Hi, Danny.
asking, how long does this procedure take?
Yeah, that's a great question, Danny. I usually tell people the procedure is going to take about 30 minutes per disc. So this lady has 2 discs we're removing, or not removing, 2 discs we're repairing, pardon me. And so I would expect it to take an hour. And by the way, when I say an hour, I mean, for my part, an hour. There's still the part where we have to put her to sleep and we have to wake her up. That's another 30 minutes, 40 minutes. Okay? Okay, we are done with this disc and we're going to irrigate, clean it out. Huh? Yeah, do you think she really has a steroid allergy, Dr. B?
Well, she's got a lot of problems with Kenalog. It's hard to say if the allergy was before, carried before the horse when you have steroid allergy.
Right.
Hard to say.
Okay, well, we're ready to bring our fluoro in. We're going to move from number 6-7 up to 5-6. We're going to do that using X-ray guidance, which is this X-ray machine coming into the field. We take X-rays front, back, and side to side to study where is our probe relative to the disc, relative to the spine, and we want to make sure that we're in the right spot. Okay, move up north, and we're going to take this out. I'll get to the questions in a moment. I got to do this first. Okay, let's go slightly more north. There we go. That's perfect. And we need to move up a disc. Everybody agree? 2, 3, 4, 5, 6. 5, 6 is next. So I'm going to come out with my tube shot. I'm going to do this under X-ray guidance. I'm going to use the X-ray to guide me because I can't see inside her body. Shot. A lot of spine surgery, orthopedic surgery, is done with what's called X-ray guidance, where we use the X-ray to guide us. Shot? All right. Now, I've got to move from this disc to the next one up. So I'm going to do that with Luis's help. I'm going to let him get situated. Are you ready? All right, here we go. So I'm going to first come out of this disc, shot, and then I'm going to move north. We call it north. There we go. I'm out, shot. Okay, now that I'm out, on the side view, I can see I'm out, but I don't know where my tip is. I think it's in the middle, but it could have moved, so I got to get an AP. Shot. AP is a front back. It did move. You see that? It moved to the side, so we don't want that. Shot. All right, now I'm back in the middle. Let's go lateral. And I told you, she does have scoliosis to her spine, which is a curvature. We're not here to fix her scoliosis. We don't want to fix scoliosis unless we have to. In her case, we don't have to. It's not causing any symptoms. Now I'm sitting over the 5-6 disc. 2, 3, 4, 5, 6. This is the next disc. So what I got to do is check my AP once again, my front back. I'm going to make sure I'm in the middle because you don't want to be off to the side when you try to drive this metal dilator in. That's perfect. We're dead center. I love it. So I'm dead center on the AP view, and on the lateral view I am pretty much centered as well. Shot. All right, I'm starting to go in to the annulus. I'm going to double check again AP because it's so important that you do this right. You cannot have a mistake, and the only way to know you're not making a mistake is to keep checking. And there we go. Show us the middle there. So you can see the spinous process below, the next one up, right there, and the one above it. And we're dead center, so it's perfect. That's where we want to be, is dead center. Take. All right. Shot. All right, so we're going to head to the back of the disc in a moment. Before I do that, I'm going to do a discogram. The discogram allows me to find the tears in the back of the disc and the herniations. Shot? All right, perfect. So I should be able to see the disc herniation and the tear both on the x-ray as well as shot with the dye, the blue dye. You can see the tear. Shot? Shot? There we go. That's perfect, guys. See the tear right there, Henry?
Yes, we do.
That is the annular tear at the back of the disc. That's where the herniation escaped. Now I'm going to advance my dilator to the back of the disc, right in the tear. I'm sitting inside the tear. That tear is the tear we want to fix. All right, I'm right at the back of the disc where the herniation is, coming out of the disc, and I'm going to go in, and I'm going to bring my tube. So the tube is how I do the surgery. Shot? Excellent. Go ahead. I've got to advance this tube, and so to do that, I got to hit it with a mallet. This is what scares most people. They don't like me hammering on top of their spinal cord, and I don't like it either, but it's a necessary thing to do. It's absolutely required. Doing spine surgery is dangerous, and that's why you want somebody really good to do it. You know, not all spine surgeons are equal. I can promise you that. I can absolutely promise you that. A lot of them are not so good, and I wouldn't let them touch me. Primary care doctors that are not so good. There's neurologists that aren't so good. We all know what I'm talking about. I mean, there's no surprise. You know, doctors get selected to go to med school because they have good grades, but there's nothing that says they are good doctors when they graduate, right? And unfortunately, most residency programs, they're afraid to not graduate a resident who's been there for 7 years because they don't want a lawsuit, and they know they're going to get one if they don't graduate that doctor. So they all just keep hush hush. They give a certificate. Here you go. Get out of here. Just don't stay where we are. Go find another place to practice medicine. And those doctors go out into the world, and they end up in your backyard. Shot? And they're out there doing bad treatments, okay? And by the way, I always talk about the bad side of medicine, but there's always good too, right? You know, we know there are good doctors out there, but I'm not going to talk about the good doctors because everybody assumes the doctors are good. What most people don't realize is that there are a lot of bad doctors. So that's why I mention that, because people need to know the truth. They need to be aware of it. You need to be aware because you don't want to be a victim of bad treatment. I mean, I don't. And it's so easy to get bad treatment. I could give you stories. All right, I know we have questions, so we'll take them. In the meantime, we're going to get started on this next disc. Now, Henry, we showed the audience how facet can cause pain, but we also showed them on the Deuk plasma rhizotomy, right?
Correct.
All right. By the way, look at all the inflammation back here, all the red blood vessels, veins. You know, all of that is called inflammation, and that's where the pain comes from. That's where the neck pain, headaches, and the arm symptoms, they all come from this inflammation at the back of the disc. All right, let's take the questions.
This next question coming from John on YouTube.
Is this Big John or just John?
Just John.
All
But
right,
John,
hi,
John asked, "Hello, doctor. What's the difference between your laser nucleoplasty and the removal of the herniation that the rest of endoscopists do around the world?"
It's a bit of an odd question. I didn't really understand the question. I heard, what's the difference between your procedure and I heard nucleoplasty?
Laser nucleoplasty, yes.
So they want to know the difference between my procedure and a laser nucleoplasty.
Yes.
Yeah, a laser nucleoplasty doesn't treat what we're treating. It doesn't treat anything, really. It's a worthless procedure. A laser nucleoplasty doesn't treat the herniation. It doesn't treat the tear. It doesn't treat anything that needs to be treated. So I wouldn't get that done. There's a herniation right there, guys. You see that? It's just literally crawling up the tube. We're going to get rid of it, float it out. That's a good one. It's a good size. That's a good 3 millimeters. And then he said something about what was the last procedure?
The removal of the herniation compared to the rest of the endoscopics around the world.
All right, so first of all, not many people do endoscopic surgery, period. There's the tear, by the way, right there. See how we're cleaning it? That allows it to heal. Because right here, this is herniation stuck in the tear and being calcified. Yeah, there's nobody else that does the necessary steps to get rid of the neck pain, the arm symptoms, the headaches, and does it endoscopically. Nobody else in the world does it. So I'm not sure what other endoscopic surgery you're talking about. There's some other endoscopic surgery where they go into the disc and God knows what they do. You know, I can't really tell you because everybody does it different. And the truth is, nobody does what we do. Nobody has as good a results as we do. Nobody in the world. Nobody. The Koreans that I learned from, they don't do this. They do it different. And they don't have the results we have. They don't have as good a results. This surgery you're watching now is the best results in the world for treating symptoms of a herniated disc, a bulging disc, a protruded disc, an extruded disc, a ruptured disc, a slipped disc, a spondylitic disc, a degenerated disc. They all are the same in terms of what they cause symptom-wise. They cause neck pain, headaches coming from the neck, cervical brachial pain, which is pain radiating from the neck into the shoulder, cervical radiculopathy, which is pain, numbness, tingling, and weakness in the arm from the neck, from the herniation. All of those symptoms, myelopathy, radiculopathy, weakness, numbness, tingling, all of them. This is scar tissue, by the way, I'm removing with the laser. All of those symptoms come from inflammation from the annular tear due to the herniation sitting inside the tear. And that's what our surgery targets. And nobody else in the world surgery targets that because they have no idea that's what causes the symptoms. Even though I've published it, even though I've given lectures about it, even though I've traveled around the world speaking on it, it doesn't sink in. You understand? It's like they're teenagers and you're telling them, don't do something you know is going to cause harm, and the teenagers don't listen and they go out and they do it, right? So it's like they think they know everything, but getting through to them, it's like talking to a brick wall. These other surgeons don't know what we do, they don't know why we do it, and they really don't care. And the problem is you, the patient, suffer because of their ignorance and their, what do you call it? Arrogance. Ignorance and arrogance. So, the surgeon's ignorance and arrogance causes you, the patient with the herniated disc, to undergo the surgery they recommend, which is a much more invasive surgery that has a much lower chance of helping you get better and has a much higher chance of complications. As a matter of fact, the complication rate of anterior cervical discectomy and fusion is in 2024 recognized to be 50%. Literally 49%, 50%. That means out of every ACDF surgery, which is the most common surgery in the world for a herniated disc in the neck, every ACDF surgery, half of the patients, 1 out of 2, is going to have a complication. Well, with this surgery you're watching, our complication rate is 0 out of 1,000 of these surgeries, cervical. And I've done 1,100 lumbar. So in 2,100 surgeries, the complication rate 0. Whereas if you do the other more older type surgery, the more recognized by your surgeon and paying the surgeon more money surgery, you're talking about a 50% complication rate. So why is that important to a patient? Well, do you want a complication? If your answer is yes, then you clearly don't know what a complication is. A complication is when you have a procedure or treatment by a doctor and you have a unwanted and somewhat unexpected bad result. And that bad result could be an injury to a blood vessel, the intestines, the spinal cord, nerve damage, spinal fluid leak, infection, hardware failure, instability, adjacent segment disease. You know, those are all quote unquote complications. I feel her contracting maybe, or I don't know if that's Luis or her, but there's some, maybe it's Luis. Maybe it's Luis.
Because she's pretty sleepy right
All right. Where's her twitches? So basically, my point to you is simple. If you want the best surgery in the world for a cervical disc herniation, you come to Deuk Spine. We have it. And you can't get it anywhere else because it's, no, I'm done. Because it's, I'll be done in 5 minutes. It's because nobody else does it. Everyone else is doing more invasive surgery. And the question of why they're doing more invasive surgery and recommending more invasive surgery is, it's about money. It's always been about money. Money, 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 money. It is driven by the companies that produce either implants or equipment, okay? And these companies, they want big money. They need to have the surgeon putting metal in your neck. They need to have the surgeon using their bone graft, their artificial bone graft, their cadaver bone or, you know, donor bone, biologics like BMP, bone morphogenic protein, or others. Basically, these big companies are driving healthcare. They are driving surgeons to be more invasive and do more aggressive surgeries. So when you ask about what's the difference between my surgery and others, well, number one, there is no big industry pushing this surgery on you or anybody else. It's literally being recommended by me because it is the best surgery in the world. And I do all surgeries. There's not a single type of spine surgery I cannot do. That's how well trained I am as a neurosurgeon, trained at the best training program in the world at the time, University of Florida under Dr. Roten. It was ranked number 1 in the world. And so I went there, I learned how to do spine surgery and brain surgery there. I was one of 2 doctors they chose that year. They take 1 or 2 every year. They took me, they took Paul Tolentino, Dr. Tolentino from Harvard, and we were some of the top in the world. I mean, Paul Tolentino went to Harvard undergraduate, Harvard Medical School, and he wanted the best residency program, which was the University of Florida in Gainesville. And that's what I wanted as well. And so we ended up training at the best residency program. Dr. Tolentino ended up doing more like brain stuff, brain surgery, and I ended up doing more spine. I studied with Jeff Henn, who was a fellow of the Barrow Neurological Institute, trained with Volkner Sontag, the best spine surgeon in the world at the time, Curtis Dickman. And so I got trained by the very best spine surgeons in the world and brain surgeons in the world. So what I'm saying is my techniques in spine surgery are from the best in the world. I can do any spine surgery, but I do this surgery, which is far less invasive, because this is better for the patients. It's not better for me. Like I said before, I make more money doing fusion, but or artificial disc. Oh, we got a big piece. That's a good one. All right, you guys see that?
Yes, we do.
That's a good one. Bring me the ruler. Yeah. You guys see that? I just pulled that out. That's one piece of herniation. Look how scarred up it is, all the white stuff. Yeah, it's a good, 5 millimeters long? Right? That's just one. Like, we've taken out probably 30 or 40 pieces already. So that's just one of many. We're going back in for one final time, and we're going to see if there's any more pieces of herniation. Any other questions?
Yes, we have a lot of questions. This next one coming from Tracy on
Let's do this. Let me come there, and let me answer them face to face, since I haven't done that in a while. Okay? I'm almost done, so I'm going to come over there and answer them face to face. What do you think, Henry?
I'm pretty good with that. Do we want to just answer one question?
Well, I want to talk a little bit more.
Copy that.
And then I can come over there and answer. But let me see here. I need to turn this here. Okay. Let me just focus on getting this done. I'm almost done.
10 minutes?
No, 5 minutes maximum. 5 minutes. 5 minutes. Like this. Look at these pieces of herniation just floating out, right? We didn't even have to release these off of the scar tissue from the annulus. They're there. And all those pieces of herniation, by the way, they're pushing down on the spinal cord. So they're causing neurological symptoms like weakness, numbness, clumsiness, all these pieces here. They're like a bag of herniations that are just sitting there on the spinal cord. And I think her husband is watching the surgery on the live stream. He was going to go watch it in the waiting room. Lovely couple. And look at the tear. That's where the herniation, there's the posterior longitudinal ligament running left and right, and there's the tear. You guys see that? That's where the herniation went out. Now I've got to go check that out real quick. Make sure that I'm not leaving any herniation behind. You can take down the PLL if you want to look for a subligamentous herniation, so I got to do that. I'm literally taking it down a tenth of a millimeter at a time. Okay, you can see there's another herniation right there. It's all scarred up. That's why it's gold color. That's calcium, calcification. Yeah. And by the way, you can see how accurate the laser is. Now, for those of you who've never seen ACDF, you cannot see any of this with ACDF. It is literally invisible because it is so deep inside the disc. If you don't see any of this. Look at that. There's some herniation there. You guys see that? As a matter of fact, it's so cool. It's like the herniation right here is below the posterior ligament, but not entirely. It's like stuck in between leaflets of the posterior ligament. And there I am. I'm just zapping out those pieces that are just sitting there. So cool. Yeah. See that? Amazing.
Yes, we do.
And I got to say, the resolution of my ConMed Limbotech camera system is amazing. I should be sponsored by ConMed Limbotech. Oh, look at that herniation. Oh, there it goes. Oh, yeah. Oh, man. Dr. Berndes, I hate it when I lie to you. I told you 5 minutes, but things are really starting to heat up here. I think 5 minutes, though, honestly. I don't see it taking much longer. I've got to finish opening this PLL. And, you know, this is something you cannot see, folks, with an operating with an operating microscope. And vast majority of surgeons that do ACDF, they don't even use the microscope. They use loupes, which are little like glasses you put on your eye. You can't see anything down here. How can they see any of this? They can't. So what a lot of spine surgeons do, since they don't have training on a microscope, they don't have, loupes. They only have loupes, or they don't use loupes at all. What they do, folks, is they literally don't even take this stuff out. They leave it. They just leave it. And that's why, unfortunately, why a lot of people do not get better when they have a fusion, ACDF. This is all scarred here. This is crazy. It's literally on top of the spinal cord. I am literally taking this out a tenth of a millimeter at a time. That's how accurate the laser is. If you want to see precision, this is it. This is literally the most precise a spine surgeon can possibly be. And it's all due to the endoscope and the ConMed Limbotech camera system, which I'm using, that allows me to see this. And it's also due to the laser. So the thing here that you should remember, it doesn't matter if you have a laser if you don't have the right optics, because you won't be able to see the laser in action. But because of this system, I can not just see this laser and what it's doing at a tenth of a millimeter, but I also can make sure I could see all the details of the tissues. And you need that. OMG. Literally, this is so old. This stuff here is it's all scar tissue. There's no more herniation there. I'm done. I'm not just going to go after scar tissue, okay? Because it's not doing anything at this point anymore. I've gotten rid of all the herniation. and I've gotten as much of that stuff out that's pushing on the spinal cord. But wow, look at that crater there. That's crazy, huh? And by the way, these are bone spurs here to the right of my laser fiber, and they're not doing anything, right? So why mess with them? Why, proverbially, why fuck with them, right? We don't need to, because you can only make things worse. I'm just trying to get more of the herniation. And like I said, you can't get 100% of the herniation for any herniation. And you can see why. There's normal bone in the way, there's bone spurs sometimes, and surgeons can't see it. That's the whole point. They cannot see this level of detail without the endoscope. And I am literally probably the only surgeon in the United States that does true endoscopic surgery on a patient. The other surgeons say endoscopic, but they don't really do endoscopic, okay? They basically lie. And maybe it's a lie of omission. Maybe it's a lie, they're just saying it because they don't know any better. They don't realize this technology even exists. All right, 30 seconds and I'm done. 30 seconds, amazing. But so far it went well. I feel like I've gotten probably 70% of the herniation out, and we don't need to take any more. But look at that. That is scarred down, all scar tissue, calcified, and I am not gonna go crazy here, okay? But that was pushing on her spinal cord, and I think now, I'm sure of it, her symptoms will go away, okay? But it's gonna take some time. Beautiful, beautiful, beautiful. Done. Nice work. Hope you enjoyed it. Type up your questions. I will come and answer them for you. You can see the incision we made is 4 millimeters. You guys see that? 4 millimeters?
Yes, we do.
4 millimeters. And yeah, type up your questions. We've shown you some nice videos. I will come and answer your questions face to face. Thank you, everybody. Great job. How is she, Dr. B? Stable?
She's doing great.
She's doing great. All right, wonderful news. All right. Yep, so we're going to take the tube out. I'm applying a little bit of pressure in case there's some venous bleeding, which is very common to have a little vein bleed. And you just have to apply pressure for a few minutes and you're done. Let me see if we're getting any bleeding. And she's here once again with her husband. Here's some pieces of herniation. You guys see this right here?
Yes,
Literally,
we do.
they're just like laying here on the side because they floated out. And one of them, you can see the red color. Can you see the red color there, Henry?
Yes, we can.
That pinkish red color on there, that's inflammation. We showed you the video. We're the first to discover it at Deuk Spine. I was the first to discover it, along with Arius, my son. And we published it. But it is inflammation caused by the herniated nucleus pulposus stuck in the annular tear called interposed nuclear herniation. That's what causes the inflammation. That's what causes the neck pain, the headaches, the cervical brachial pain, the cervical radicular pain down the arm, and it can even cause weakness, numbness, tingling. All right, let's take a look. And there it is. So it looks like she came to Florida and a vampire with one tooth got her. You know, we have vampires with one tooth down here. You know, they don't take care of their teeth. They don't brush regularly. They don't floss. And inevitably, one of the tooth will break off, and then you got a vampire with one tooth.
It's like my 13-year-old Chihuahua. He's got one tooth.
Your Chihuahua? Yeah. Scope use is a 7. All right, type up your questions. I am going to come over there and answer them face to face. See you in a few. Henry, you want to show them 30 causes of neck pain?
Yes, sir.
I'm Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. I'm Dr. Deuk Machen, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube, and what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
and I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday. Today's Wednesday, and we're going to stay till Sunday. Enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them.
Yeah.
All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. Good morning, I'm Dr. Deuk Machen. I'm here with one of my patients from Canada who traveled actually from Toronto to Florida to have Deuk laser disc repair to fix 2 herniated discs, one in his neck, one in his lower back. And you had your lower back done last week, and we were actually supposed to do your cervical last week, and we had our air conditioning break, and we got it fixed over the weekend, and you had your neck done yesterday. So you've actually had the Deuk laser disc repair done on your neck and your lower back. How's your lower back feeling?
Brand new.
Amazing,
As if it was never injured. I still am in shock. I can't believe that you were able to achieve this result after I've been suffering with this problem for just over 5 years now.
Yeah, since your accident.
Yeah.
Trauma is the cause of herniated discs. You herniated your disc in your lower back. You had pain for 5 years. In Canada, what did they do to treat your pain in your back and your neck?
I started with medications, nerve meds, narcotic painkillers. I was instructed and told to have nerve block injections to help with pain management. I did physio, I did chiro. Finally, I got to a point where I started to do the nerve ablation therapy, and I did two rounds of that.
But the pain came back.
And the pain all permanent solution, so I can get back to, having some normality of my life. And I found the Deuk Spine Institute, sent my MRI over right away. I had my consultation within not even 10 days with Dr. Deuk in person, like in Zoom. 3 weeks later, I flew out here and I feel like brand new.
It's amazing,
so thank
isn't it?
you. Yeah,
You're welcome. You're welcome.
This was life-saving for me because I didn't really have a great life before this experience.
And you can tell the pain is gone now.
Yeah, I was having numbing in my legs. There was days where I couldn't even walk. I was completely debilitated, stuck in the house, pain, numb. I thought I was going to be like paralyzed at one point. That's how bad it was.
And how are those symptoms now that you had the procedure?
Gone. I have full feeling back everywhere. Like, it's unbelievable. I can't believe it.
All with the Deuk laser disc repair. You could see we went in and we found the actual tear where the herniation came out in the back of the disc, and we used the laser to clean it out, debride it. Now here you are doing fantastic.
Yeah, thank you.
You're welcome.
So much.
Is there anything else you want to tell your fans out there?
I did my neck. I did my lower back. I had the worst symptoms. I came here, an hour each procedure. This is the day after. I had my procedure yesterday at, what time did you take me in? Like after 9 maybe?
Yeah, around 24 hours ago.
And I haven't taken any medication since I was discharged and gone back to the hotel. Not even Tylenol. Like, I feel great. It's unbelievable. I highly recommend anyone that's suffering like this to just come out and get fixed, because you will definitely have a way better quality of life. Don't suffer.
Yeah, don't suffer.
Don't suffer.
We can fix the back and neck.
There's
pain
a
here.
solution. He's the solution.
Thank you.
This is real. Everything you see on the internet about Dr. Deuk is real. Any negative reviews you read about Dr. Deuk are none. They're not real. They're just people that are just not happy with themselves, because I read them all on Google and I had to make this decision, and I'm very glad I did, because I believed everyone that was talking about their results, and here I am. So thank you.
Congratulations, my friend.
Thank you.
Enjoy the rest of your life.
Thank you.
Yeah, you're welcome. All right, let's get you out of here. And good morning, I'm Dr. Duke Machen, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great. Feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah, it's a little overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right, congratulations. You're welcome.
Thanks again.
I'm Dr. Duke Machen with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4-millimeter cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turning to when I couldn't hardly turn to my right. It was going down into my right arm.
Okay, yeah, we cut that one short because great story from her, but we want to get to the question and answer section of the surgery. I am Dr. Deuk Majan. I'm the CEO and founder of Deuk Spine Institute, along with my son Arias Deuk Majan, who's not here. He's at Princeton. But that said, we just completed 2 discs repaired in the neck through 1 incision, 4 millimeters. And this is the transdiscal approach called transdiscal. You're going through the disc. That was taught to me by the Koreans, Dr. Sang-Ho Lee, Dr. Gun Choi. They are the pioneers, mostly Dr. Sang-Ho Lee, pioneer of the technique. I learned it 19 years ago and brought it to the United States from overseas and started performing it in Florida 18 years ago. So 18 and a half years ago. And we've been doing it now for 18 and a half years. The technique has not changed very much. It's pretty much the same. I learned the endoscopic part from the Koreans, and then the laser I incorporated myself and started cleaning the annular tear, getting rid of those herniations, and it's the Deuk laser disc repair. We've been doing the Deuk laser disc repair now for 18 and a half years here in Florida. And I've tried to teach other surgeons. Unfortunately, they're not interested because they're making way too much money doing fusions and artificial discs and laminectomies and pain procedures. They're keeping you guys in pain so they can make money off you. It's really sad. We want people out of pain. We want them fixed permanently. Now this patient had 2 discs. We fixed them. She also has facet pain. We wanted to fix that as well. She wants to hold off. She wants to wait and see. And she may end up coming back to get those facets treated. But she has both discogenic pain and facetogenic pain. All right, let's take our questions.
All right, this question coming from Tracy on Facebook asking, when performing a performance release, would you have concerns if a patient were to have a split piriformis when there are essentially two piriformis muscles, each with their own tendon? Might this be something you could feel while performing the procedure? And also, could another possible concern be with the variation where the piriformis is fused to the gluteus medius tendon? As always, appreciate your insight.
So Tracy is asking about a different procedure and a different problem. And the piriformis muscle she's asking about is a muscle that is not in the neck, it's in the lower back, in the buttock as a matter of fact. And if you look here at this model, this is the femur or leg bone. Here's the pelvis. The sacrum literally sits right here, the tailbone. So the piriformis muscle runs from the sacrum over to the top of the hip. She's saying, what if there's not one tendon but two, and there's two muscles attaching? Would you be able to tell? Would you be able to fix it? And the treatment that I pioneered and patenting is the Deuk piriformis release. It's basically releasing the muscle off the femur, and you're releasing it off the greater trochanter. Long story short, yes, we're going to be able to release both muscles. And if it's attached to the gluteus medius, how does that affect it? Well, what we do is we release the fibers all the way up to the top of the greater trochanter, that superior posterior tubercle, and we stop. And we've never had a failure. Every one of our patients that we did the piriformis release, the piriformis pain is gone, 100%. So it works, and it's bloodless, and there's no hospitalization. We're not cutting your butt cheek open. It's all done minimally invasive 4mm incision. It is one of the greatest discoveries of this era is this minimally invasive percutaneous piriformis release that I pioneered. But it works, and I think you won't have a problem even if you have a split piriformis with two tendons, even if it's attached to the underside of the gluteus medius. No problem.
Next question coming from Smarzig on YouTube, asking, how many people have you trained in this technique?
Smarzig. So, unfortunately, nobody has come to Deuk Spine. I'm trying to train people through this media, through YouTube, Facebook, X, and LinkedIn, by streaming. We're trying to generate interest, not just of people suffering with these conditions, but also doctors, surgeons, so that we're raising awareness that there is now a better way to treat these disc problems besides invasive surgery like fusion or artificial disc or laminectomy for amyotomy. The problem is, believe it or not, this is incredible, you'd think that this treatment, which is amazing, it would just catch like wildfire, everybody would do it, right? But there is what I call the spinal industrial complex, all right, which is basically big businesses that make a lot of money by selling those metal implants that we all know about, the metal plates, the screws, the cages. This surgery we just did would normally use the plate, the screws, the cages. It would generate $10,000 in revenue. And remember, there's 400,000 of these surgeries done every year, ACDF. So what's 400,000 times 10,000 on average? I don't know the numbers, but that's like a lot of money, $4 billion maybe.
It would be,
well, somebody else good at math can do it.
Either 4 or 40 billion.
Either 4 billion or 40 billion. A lot of money for a piece of metal, right? Think about the profit here. These companies do not want my surgery becoming popular because they do not want the Deuk laser disc repair to get rid of their business. Okay?
4 billion.
4 billion. 4 billion. So if the Deuk laser disc repair was done by every spine surgeon, then the companies would lose $4 billion in revenue. And every year it goes up. More and more surgeons are doing fusion. So the number keeps going up. The age of the population keeps going up. more people need surgery on their neck than before. Every year it keeps increasing. And this business model, this $4 billion they make, I mean, I hate to say it, but that metal plate and screws and that plastic cage, it doesn't cost $10,000 to make it. It probably costs, I don't know, maybe $100 at most, $100 to produce it, distribute it, right? So even if you made it $1,000 cost to the company, they're getting $10,000. That's $9,000 profit. That's 900% profit. To starting to understand why they're going to fight my technology. They do not want endoscopic Deuk laser disc repair. We don't use any implants. We would put them out of business, and they don't want to go out of business. We would rather I die than they go out of business. I hate to say it. I got to keep looking around in all the bushes to see if there's a sniper aiming at me. No joke. But if something happens to me, understand why it happened to me, right, Henry?
Yes, sir. Yep.
And Henry is going to give a call over to the Israelis
Yeah.
and bring in some of the soldiers,
Yeah.
right,
Yeah.
to avenge my death. All right. Anybody ever see the movie? It's called Contract Killer. All right. King of Killers is in that movie, and it's about this rich Japanese guy. He was a bad guy. I'm not a bad guy, but he was taken out, and he had $100 million fund for whoever found his assassin and brought them to justice. So I'm going to set up not a $100 million fund because I don't have that kind of money, but maybe a $100 fund.
Ah, yeah.
For whoever finds my assassin. All right, I joke about it, but it's serious stuff. I mean, I could put big companies out of business, and they do not want to go out of business. They don't like that. So I'm trying to teach surgeons, but they are all set in their ways, and they're making so much money with fusions and artificial discs, they don't want to lose that money.
All right. These next three questions coming from Ping on Facebook.
Ping. That's excellent. Let's go with Ping's question.
First question they ask: can you remove all the nucleus pulposus to avoid reherniation?
Ping. Shame on you. Question is, can I remove all the nucleus pulposus to avoid reherniation? I mean, I like the way you think, Ping. You know, avoid reherniation, but the answer is yes, but no. I'm not going to. Removing all the nucleus pulposus is unnecessary. What you should really be asking is, Dr. Deuk, if you leave nucleus pulposus in the disc, can it reherniate? What's the chance of that? It's 1%. In my patients that have this surgery, 1%. The next question is, well, why do people reherniate? The answer is they do things they're not supposed to do. They're lifting heavy things, and they're involved in certain activities like lifting, twisting, contact sports that cause them to reherniate. So you will not reherniate if you wear your collar and keep your lifting under 40 pounds your first year and don't do contact sports. You will not reherniate. Your disc will heal naturally. You don't need to remove all the nucleus. I don't recommend it. I would never do it. Even if you ask me to do it, I won't do it.
Next question from Ping asking, also, will MSC stem cells or PRP injected around the disc after the surgery help the disc heal much faster?
So Ping, you're asking a great question. Will using stem cells or PRP help the disc heal faster? The answer is no, not in my experience. We've tried it. It doesn't work. All it does is create inflammation. We know that stem cells and PRP make inflammation worse. And that's what we're trying to get rid of, is inflammation in the disc, not make it. And I've tried the stem cells and the PRP in a patient in the past, and all it did was create huge problems for the patient, like lots of pain. And the pain took 3 months to go away. Normally the pain takes 1 day, it's gone. But this patient, it took 3 months. So I do not recommend stem cells or PRP or anything. It's a natural procedure. We're just helping your body heal itself, that's all.
And then lastly from Ping asking, is there any drawbacks / downsides to killing the medial branch of the dorsal ramus nerve?
Oh, so is there, great question, Ping. Ping is saying when you do the Deuk plasma rhizotomy and you're destroying the medial branch of the dorsal ramus nerve to the facet joint, that's painful. Is there any drawback? The answer is absolutely no drawback. That nerve, all it does is bring pain signals up to your brain so you can be in pain all the time. You don't want that nerve. It's unnecessary. It's as useful to you as a tumor. So get rid of it.
And then lastly, these last two questions coming from HR08 or Hero8, coming from YouTube, asking, first question, sir, is arthritis an autoimmune disease, or why this autoimmune disease happens? Why can't we stop that?
So Hero
Yeah,
Hero 8, thank you for asking questions. Is arthritis an autoimmune disease? The answer is yes and no. It depends on the type of arthritis. But the arthritis that we are treating right now is not autoimmune. It is what's called osteoarthritis. And what it is basically is your body has two, it's quite fascinating. We have lots of defense systems, right? You got your skin, you got your mucosa, you have barriers to infection and foreign invaders to your body, right? You're constantly warding off foreign invaders, like the walls of a castle, okay? The walls of a castle. Your skin, your integumentary system is like the wall of a castle. It keeps out most of the bad guys. However, sometimes the bad guys get in, right, through the door. And when they're in, you need to recognize they're bad and you need to get rid of them. So there's two systems that we have to do that. One is called the immune system, the other is called the inflammatory system. Now, they're not the same, they're different. The immune system is far more advanced, more sophisticated, technologically advanced. Of course, evolutionarily, it's further along, it's more developed than the inflammatory system. Now, the inflammatory system, think about it as, I shouldn't make any analogies, okay, because I'm going to get in trouble here. But think about one being like the Air Force, one being like the Marines, okay? And I'm not going to say which one because I'm not trying to do that. I'm not trying to make that analogy. What I am saying, yes, thanks. What I am saying is that they're different divisions of the defense of your body. One is Air Force, one's Marines. They're not the same. They work together sometimes. They cooperate, but they're different. You know, they're different. And so the immune system is very sophisticated and rarely makes mistakes. The inflammatory system is more of a, you know, hey, is that a bad guy over there? Shoot him up. Boom, boom, throw grenades, throw missiles. They blow everything up. They're like, is that a bad guy? I think it is. It doesn't look right. Destroy him, all right? So it's more of a shoot first, ask questions later mentality, your inflammatory system. Why? It's less sophisticated, it's older, it doesn't really make sure that what they're attacking needs to be attacked, right? Whereas the immune system, it relies on very specific information, transmission to attack. All right, so we're going to put the immune system aside. We're just going to talk about the inflammatory system. Now, osteoarthritis, the most common form of arthritis in human beings, is not immunologically mediated. It's not controlled by the immune system. It's controlled by the inflammatory system. And basically, you injure your joint, your facet joint, trauma, you fall off a roof, you skateboard, you do some wakeboard jump and try to do flips in the air and you land on your back. You damage your disc, you damaged your facet, you tore the capsule, now the capsule's torn, your inflammatory system comes in, and it's like, hey, we got to heal this, and it tries to heal it, but you're still moving around, so you keep tearing it, and then you get this inflammation that just sits there for months and years trying to heal when it can't heal, and it's also trying to clean out the damaged joint. So you get chronic inflammation, which then causes granulation tissue, little nerve fibers, very painful. You get a painful joint, all right? That's from osteoarthritis. That's from inflammatory system arthritis. On the other hand, Very rarely do we have immunologically mediated inflammation, like rheumatoid arthritis would be the primary example, psoriatic arthritis another example. Here's where your immune system gets it kind of wrong, where your immune system is activating the inflammatory system to come in and attack something it shouldn't be attacking, like a joint. And that's why rheumatoid arthritis, it's immune mediated inflammation. Psoriatic arthritis, same thing. Okay, so you have osteoarthritis, which is non-immune mediated, it's all inflammatory, and you have immune mediated inflammation. Okay, much less common.
And then lastly, from Hero8, once more on YouTube, asking, Sir, what are good neck exercises to avoid such serious conditions like the one you just operated?
There is no neck exercise, Hero8. If you have a herniated disc and it's causing you symptoms, the best thing you can do is come to Deuk Spine, let us fix it now before it gets worse. You saw this patient, the second disc I fixed, all that scar tissue and calcium sitting on top of the spinal cord. That's what happens when you don't get your disc fixed early. When you let it go, the inflammation, the scar tissue, the calcium, the bone spurs, they all get much worse, and they make it more risky for you for complications. All right, that's it?
We just got a lot more questions. This next one coming from Jonathan on YouTube.
Hi, Jonathan.
Is nerve pain always present with herniations, or nerve stimulation if not pain, I mean?
Great question, Jonathan. Jonathan's question is, do you always get pain when you have a herniated disc? The answer is no. Vast majority of herniated discs cause zero symptoms. Zero symptoms. We leave those alone. The only time we operate, we at Deuk Spine operate, and the only time we recommend operating is when the patient has symptoms from the herniated disc. Those symptoms include neck pain, cervical brachial pain, cervical radicular pain down the arm, weakness, numbness, tingling in the arm, and headaches, cervicogenic headaches, or myelopathy, spinal cord dysfunction, balance problem, urinary incontinence, discoordination of the hands. Those are all symptoms related to the herniated disc. They require surgery.
And then from Brad on YouTube asking, are there medial branch nerves that innervate the C1-C2 facet joint, or is it just the C2 ganglion that innervates the intellectual?
Great question, Brad. Very, very sophisticated question, Brad. So Brad's asking about the C1-C2 joint. And lots of chiropractors try to tell patients they have a C1-C2 instability. It's nonsense. Don't believe everything they tell you. But basically, the C1-C2 joint is very difficult to treat. There are no medial branches. You cannot do a rhizotomy at C1-C2. It's impossible. The only treatment for C1-C2 joint pain is a fusion of C1 and C2. And we do those at Deuk Spine. I've done 8 of them for patients with arthritis in the C1-C2 joint. And we have to diagnose it through a block where we numb up the joint and then it takes the pain away. I recommend a C1-C2 fusion. I can perform that surgery. It takes an hour and a half to do, and it's relatively safe when it's done properly. All right.
Lastly, we have one more, last but not least, from Tracy once more on Facebook asking, you mentioned that MRIs are not the end all, but more a starting point for diagnosis. Curious, how often are you surprised during a DLDR surgery how a disc that did not look so bad on the MRI is in fact much worse?
Great question, Tracy. Thank you. So Tracy's pointing out that the MRI obviously is not. It has its limitations, we call it. All right. It doesn't show all the detail, and of course, temporally, you get an MRI 2 months ago, the disc can get worse today, right? So 2 months later. It does happen. I would say that I'm surprised in the operation that the disc is worse than the MRI appearance. About 1 in 20 patients. The other 19 out of 20, it's pretty much what you expect.
And that is it for questions.
Okay, we have another surgery to do. I'm about to go in the operating room. This next patient travels to us from Georgia, and he has facet pain, L344551. We're going to do the Deuk plasma rhizotomy, bilateral L344551. Then he's got bilateral SI joint pain. We're going to do both sacroiliac joints. All right? So join us in just